So Anne is a 54-year-old woman. She's just gone through menopause, and her hot flashes and night sweats have finally subsided. And she's starting to feel like her normal self again. But she notices that her memory just isn't as sharp as it usually is. She is a CFO of her company, and she is used to being very quick to estimate numbers, but finds that skill is slipping a little bit for her. She multitasks and manages complex schedules, but knows now she has to take a lot of notes and leave Post-its everywhere to stay organized. At times during conversation, she finds herself struggling to find a word. She comes in to see me, but she is concerned about these memory changes. She had a mother who died in her late 70s, and she's worried that these are the early signs of Alzheimer's dementia for her. Anne is like many Americans who list cognitive decline as one of their top health concerns. She knows that Alzheimer's disease starts out with subtle memory changes that progress over time. And what we found with Anne when she came in is that she was actually in what we call preclinical or subclinical cognitive impairment. And that just means that when we do all of our cognitive function tests, everything comes out normal, but she notices that things are slipping. People can live in this stage for many years before they go on to stage 2, which we call MCI, or mild cognitive impairment. And that just means that at this point now we're able to measure that there is indeed some cognitive impairment. It's not until memory impairment goes on to the point where it interferes with your ability to do tasks at work or home where the diagnosis of dementia then can be made. And the majority of cases of dementia are due to Alzheimer's disease. 5 million Americans. That is the number of individuals who are currently diagnosed with Alzheimer's in our country today. 1 out of 3 seniors will die with Alzheimer's disease, making Alzheimer's the 6th leading cause of death in our country. We've seen over the last 17 years that there's been a 14% drop in deaths from heart disease, where for deaths from Alzheimer's disease, they have skyrocketed 88%. $258 billion a year is what it costs to care for individuals with Alzheimer's disease. This number is estimated to skyrocket to over $1 trillion by the year 2050. So I'm going to stop there, and if you're reaching for your Prozac, or if you're like me, little St. John's wort, I want you to know my talk is not just all doom and gloom, that there is hope in this whole message of Alzheimer's disease, so bear with me. What is Alzheimer's disease? Alzheimer's disease is a neurodegenerative disease where your brain cells are being attacked, your neurons lose connection with each other, and then these cells die over time, leading to brain atrophy. And you can see on this image, what a normal PET scan looks like for a brain and how an Alzheimer's disease these brains are starting to shrink. One of the hallmark findings of Alzheimer's disease is the presence of what you may have heard of, these amyloid plaques and tau tangles. What are they? They are these proteins that act like kind of little Velcro balls. They kind of gum up the system, and they interfere with the transmission of messages between our neurons. It's debated whether or not these are a cause or an effect of the disease. 1906 was the year that Dr. Alzheimer's first identified a patient with this disease. It has been over 100 years and billions of dollars in research racing for the cure. And what do we have? We have 5 drugs. 5 drugs with such names as Exelon, Namenda, Aricept. 5 drugs that have such limited impact on the symptoms of this disease and the progression of this disease that there's a debate whether or not it's even worth to prescribe them because of their high cost and side effect profile. So why is it, after all these years and dollars spent, that we have so little to offer victims of Alzheimer's disease? Well, what we're coming to learn is that Alzheimer's disease is a chronic illness. And chronic illnesses like diabetes, hypertension, heart disease, they are not cured by drugs. When we take a drug approach, when we take this pill for an ill silver bullet, what we find is that patients actually get put on a growing list of pharmaceutical drugs while their condition deteriorates over time. What science is showing us is that chronic illness is not due to just one underlying mechanism. So those of you who are hoping that there's going to be this blockbuster drug that's going to come and take care of us all, I have some bad news. Because what we know about chronic disease is really due to multiple metabolic disturbances in our body, multiple systems that are being affected. So there isn't going to be a drug that can hit all of these different mechanisms. So how do we approach chronic disease if that doesn't work? Well, what we're saying as a functional medicine doc is that we need to shift the paradigm. In functional medicine, what we do is we ask the question, why? What are those underlying mechanisms? So instead of just saying, aha, we've made the diagnosis, you have Alzheimer's disease. I'm so sorry. We want to go on and we want to say, okay, what are the things that led up to your brain starting to go through this degenerative process? And if we look at those underlying mechanisms, that's where we're seeing hope in this whole reversal of chronic disease. So it's really about looking at these root causes, and that's where we want to kind of shift our healthcare system. It's using this functional medicine systems biology approach where we're really seeing some exciting things coming in the treatment of Alzheimer's disease. Dr. Bredesen is a physician who has spent decades researching what those mechanisms are. And what he's shown is that if we actually treat underlying mechanisms, we're able to see that we're reversing what happens with cognitive decline if it's treated in its early stages. What he's showing is that Alzheimer's disease is really the result of multiple hits to our brain. Things that come from such things as chronic inflammation, toxic exposures, poor diet, hormone imbalances, combining this with your genetic predisposition. So we have to go after those underlying mechanisms, and that's where we're really seeing some hope. He has postulated that these protein plaques and tangles that we hear about are actually a protective mechanism of your brain when it's exposed to 3 metabolic insults. And those metabolic insults are 1, chronic inflammation. And chronic inflammation, I mean, it made Time magazine, the silent killer. You'll hear about chronic inflammation. Chronic inflammation occurs from such things as poor diet, chronic stress, chronic illnesses like diabetes. These all set our body up in an inflammatory pathway. The other thing we saw was when the brain lost support of hormones or vitamin D. And the third thing, when our brain was exposed to toxins. Those were the things that caused your brain to respond with putting down these protein plaques and tangles. So, what the approach needs to be then in dealing with a patient who has cognitive impairment is really kind of starting to look at the roots, and that starts with a great diagnostic evaluation. The thing that we start out with is doing some kind of cognitive function testing because we need to know where you are on this scale of cognitive impairment. We have many different tools. You can do simple tests like mini mental status exams. We have computerized testing in our office where we can look at cognitive function from that way. But you need to have some level of kind of cognitive testing to see whether or not, identify what stage you're in. And then laboratory testing is really imperative to looking at those roots. What are your individual metabolic disturbances that are contributing to your brain not functioning optimally? We look at things like, vitamin D, toxic levels, inflammation markers, sugar status. These are all important roots to having your brain have problems with degeneration. And then imaging. Brain imaging has really come to the point now where we're able to, through PET scans and MRIs, identify patterns that are consistent with an Alzheimer's type of process, or be able to look for other underlying pathology that also may be a part of this dementia or cognitive impairment picture. And then lastly, genetic testing. There are a lot of different genetic mutations that are playing a role in your risk for developing Alzheimer's disease. But one of the most important ones is this ApoE4. And ApoE4 is important because 20% of the population is a carrier for this mutation. If you do not have any of these, if you don't carry a copy of this mutation, your lifetime risk for developing Alzheimer's disease is 9%. If you carry one copy, or what we call heterozygous for this mutation, you have a 30% lifetime risk of developing Alzheimer's. If you carry two copies or are homozygous for this, your lifetime risk is 50 to 90% that you will develop Alzheimer's disease. That means that your chance of getting Alzheimer's disease is greater than not. So what is this ApoE4 mutation? It actually is a gene that is regulating how we transport our lipids, and it also plays a role in our inflammatory markers. So knowing your status can actually be beneficial, and I would recommend even in your 40s understanding what your ApoE4 status is, because we can start helping your body accommodate to some of those deleterious kind of changes. If you make some lifestyle changes in nutrition, exercise, things like that, some very targeted things can actually change whether or not these mutations will translate into degeneration in your brain. So ApoE4, incredibly important. So how do we go about fixing the brain? Well, here's the protocol. I can say it doesn't look too revolutionary to me. And because really this could be what I prescribe to my patients if they had heart disease or if they had many other diseases, with a few variations, really kind of working on that underlying ground is how we treat chronic disease. And that's what Alzheimer's is. So the first thing we look at is nutrition. And you're going to hear it from a lot of our other speakers today, is how important nutrition is in longevity and disease prevention. And right now, what we say is food is medicine. And it's been never more apparent than now that that is the case. With all of our clinical studies, we're able to show that different diets truly impact your biochemistry. And so they're going to be much more powerful than anything you can do with any silver bullet drug that's ever going to come out on the market. What we in the protocol, the diet that we really put patients on is going to be, number one, a low glycemic diet. And that means getting rid of the junk, cutting out sugar, cutting out white flour, really looking at foods that take a while to kind of turn into sugar in your body, and really having it be rich in all kinds of colorful fruits and vegetables. The ones that have shown the strongest data in terms of Alzheimer's disease prevention are green leafy vegetables, blueberries, and if you have fish once a week, there's one study that showed that you reduced your risk of Alzheimer's disease by 50%. So some interesting things, but we know diet is critically important. The second thing that we're seeing with diet is this whole concept of intermittent fasting. And in this protocol, we're having patients fast 12 hours a day. So 3 hours before bedtime, you stop eating, and you wait until 12 hours the next morning before you eat. And it's this that we're seeing chemical changes where insulin levels drop, and it also, eating this way, decreases the development of these protein plaques and tangles in your brain. And you'll hear this whole concept of calorie restriction, intermittent fasting, even some of other speakers, how that is going to affect longevity markers and other different health parameters. And then the third thing that they found helpful was for patients who had significant cognitive impairment, looking at this whole concept of a mildly ketogenic diet. And a ketogenic diet is really kind of a high, healthy fat diet. So instead of burning carbohydrates that turn into sugar, your body's burning fat and it makes these ketones. And these ketones have been shown to be actually very beneficial for the brain. Even in other things, we have kids who have refractory seizure disorders. They put them on this ketogenic diet, their seizures go away. There are new studies looking at brain cancers. When these patients are put on this ketogenic diet, they're seeing shrinkage of tumors, greater response to things like radiation and chemotherapy. So there's something going on with our brain and how these ketones respond. So if you're ApoE4, that certainly is something that can be helpful to pursue earlier on, but it is something that you would want to work with a professional nutritionist to kind of help you on. It's not something you want to really explore on your own. Secondly, stress reduction. Again, a common theme, but stress reduction is important because cortisol, which happens, which gets elevated when we're stressed out, causes brain atrophy. So we live in a stressed out world and we don't have tools to help our body recover or manage that stress. So having a relaxation practice, whether it be meditation, Tai Chi, yoga, whatever it is for you that helps bring that stress down, those are really helpful things to keep your brain healthy. Sleep, incredibly imperative. I don't know, this guy might have sleep apnea, and that's a real issue in Alzheimer's disease. I need an O sign or something on him. But 8 hours, that's what they're saying that these people need to help their brains recover. And the other thing is you need to be oxygenating while you sleep. So if you're having cognitive impairment, considering to be screened for sleep apnea, there's simple home sleep studies that can be done to see whether or not you're having oxygenation issues, because that is one of the hits to the brain that causes a problem. So you definitely want to rule that out. Exercise, you're going to hear that. We have other speakers who are talking about exercise. Amanda and Keith and are going to be talking about this. But just some basic things that we say is that movement most days of the week, so at least 4 to 6 days a week, 30 to 60 minutes. Especially ApoE4, high-intensity interval training, building muscle. Amanda's going to talk a lot about muscle. That's really important in how our body's biochemistry is shifted. So we really want to kind of focus on those things. Optimizing nutrients, not even just normal, but optimizing nutrients. And we're talking about your omega-3 fats, generally from fatty fish. We're talking about, looking at vitamin D levels. That was one of the metabolic, changes that impacted our brain. Those are really important nutrients in brain health. So you want to see where you are with those. And then hormone status. That's really a controversial issue in terms of, should somebody be on hormone replacement therapy or not. But when it comes to this conversation of brain health, what we're seeing is that hormones have a big impact on how your neurons function. And so it is a conversation that is worth having with your physician as to be whether or not you're a candidate to be on hormone therapy. If you're high risk, ApoE4, things like that, that may be something that you want to consider. Toxins. Our world is an incredibly toxic place, and each year it's more so. We're exposed in food with, pesticides and herbicides and the chemicals we put on our body. They're everywhere. We need to lower our toxic burden because these toxins impact our whole body, and our brain is really one of those sensitive markers. And again, we're seeing, skyrocketing rates of Alzheimer's disease, and I don't think we can, put our finger exactly what it is, but I certainly feel that toxins are playing a strong role in what that is. So you can get tested for things like what is your heavy metal burden. Those are things you want to consider if your brain is just not functioning properly. Brain stimulation. Our brains continue to grow throughout our life. And if we remove the stimuli that promote that growth, then we go into kind of this atrophy pattern. So how do you stimulate your brain? Learn something new. Learn a new language. Take on a new hobby. Any new task really helps our brain kind of engage on multiple areas, and that is really beneficial. There are also some brain exercise programs. There's an online program, Brain HQ, that has probably the most data behind it as being one of these brain exercises that helps cognitive function. But again, just make sure that you're not sitting at home, not engaging your brain in something meaningful, because I think that's really an important piece of maintaining brain health over time. Targeted nutraceuticals. Our goal is not to put you on a shopping bag of pharmaceutical or supplements. That's really not our goal of brain health. But we do want to individualize and customize the program to what your individual metabolic disturbances are. Certainly, some of these supplements can play a role in making those shifts, and so that's where kind of having a customized program is important, so you don't end up on every commercial that you hear of something that's supposed to keep your brain healthy. The two most powerful things out of this kind of 8 things I kind of went over in the protocol were, number 1, exercise. You got to move, super important for our body. And number 2, being on this mildly ketogenic diet that's rich in plant-based nutrients. If you're going to at least do those 2 things, those probably have the most power of the whole protocol. The theme really of treatment is you gotta step in early. The earlier you start to make those changes, the less likely this kind of cognitive impairment is gonna go on and progress. And then it needs, again, be customized to what your individual metabolic disturbances are. There isn't a one-size-fits-all program, so that's where the diagnostic evaluation needs to come into play. And this is something that requires active engagement from the patient side. This is a lifestyle program, so lifestyle is one of the hardest things for us to change, but so unless you're willing to kind of make those things, your chance of being successful in reversing cognitive impairment goes down significantly if you're not actively involved in that. So I want to leave you with a message of hope in that your destiny is not that of your mother or father's genes. If you make some of these beneficial lifestyle changes, you can guarantee that your brain is going to be healthy for the long term. Thank you.